We're talking with Alicia Arbaje, an assistant professor of medicine at the Johns Hopkins University School of Medicine. Dr. Arbaje, you're a geriatric specialist, and you talked about lessons that geriatrics can learn from pediatrics. Explain that for me.
What's really interesting is that there's a lot of similarities between really young babies, premature babies, and older adults with multiple chronic conditions. And the similarities are really a few. One is they're complex. They have a lot of needs. They may be voiceless. They may not be able to express those needs. They may be on a lot of medications, have a lot of healthcare providers. And basically what really links the two of them is that they can be isolated, and they're in there's a big need for coordination of care for them. So it's very important to be able to tailor healthcare for the special needs of this population.
Okay. You also told us about a patient named Walter who had a 1-year merry-go-round of healthcare services. Tell me a little bit about kind of the scope of the care that he received and what the impact is, and how do you actually try to manage something like that?
So Walter's an older gentleman who has about 5 chronic illnesses, 3 different doctors, 8 different medications, and he's a widower, he's on a fixed income, he lives alone, he's got a daughter who helps him out, but she is a few miles away and is not always able to be there because of her own needs and things that she has to take care of. And really during an entire year, if you just take a snapshot of his life, he had been into the hospital, he'd gotten all these different prescriptions for medications, he had basically been a victim of our fragmented healthcare system and had challenges navigating through the system, and in the end wasn't really able to manage his own health, and his daughter became stressed and wasn't sure if she was going to end up needing to put him in a nursing home because she couldn't really handle and navigate the care system. And so what we do in geriatric medicine is that we are there to help coordinate that care, to be the person looking at the big picture. We focus on things that are important to the older person like Walter, which may not be so much his blood pressure or his heart disease, but it might be more his quality of life, how many medications is he on, and can he do the things he wants to do. So that's really what our focus is as geriatricians, is to focus on the big picture and help coordinate his care so that he can navigate the healthcare system safely.
Okay, now you've also done research about the services that can and should be available for older patients. And there's a real mismatch between where the patients live and where the services are. Can you explain that a bit?
Yeah, what we did was really rank or rate hospitals across the country as to how senior friendly they were. Were they offering services that were important for older adults? And really what we found is that there's a variation across the country that's very wide. So meaning some parts of the country, hospitals offer a lot of healthcare services for older people, and in other parts of the country they don't offer as many. And the problem with that is that where the services are being offered are not necessarily where older adults are living. So what this tells us is that there may be a mismatch in terms of where the needs and supplies are, and what the problem could be is that we're not actually prepared as a healthcare system to deal with the complex needs of the older adult population.
Okay, and finally, you said in our current healthcare system we rely on the patient to manage all of their care. What is the alternative? What are the new options you would like to see?
I think there are several things that we can do to help improve the experience of care coordination for an older person and their family. First, I think the most important thing is to create an incentive system financially for healthcare systems to want to coordinate care, to make it financially feasible for them to do that, because right now it hasn't really been until very recently. So there are provisions in the Affordable Care Act that are helping to create accountable care organizations so that hospitals and clinics and home health care agencies can share the savings and the risks associated with taking care of older adults. So one angle is changing the financial incentives. Secondly, we're really working to help train providers, healthcare providers, doctors, nurses, to learn how to coordinate care better. It's not something taught in medical school or nursing school typically. So really teaching people how can we coordinate care better. And the third angle is really helping patients and their families to understand what they can do to be advocates for their health and to be savvy navigators of the healthcare system. Things like using only one pharmacy, making sure they always have an advocate with them wherever they go, making sure they have as least number of medications as possible, and making sure they schedule regular checkups with their doctor to remove medications that are no longer needed. Those are some examples of things that people can do.
Okay, I think that's all we need. Thank you very much.
Great.